Hi, Dr. Yas here. I'd like to try to give a grade to the existing overall medical establishment in their ability to treat chronic pain. I think if you look around at the level of people suffering from chronic pain, the widespread epidemic use of addictive pain medication in the form of pain management, those people who are being told that there's nothing left that can be done for them and that they have to suffer with their pain for the rest of their lives, or those who are being told that the pain is simply in their head and that it's just being made up. I think if you look at this level of people who just continue to suffer, the answer would have to be that the grade would be a huge unadulterated F. Most of you are continuing to suffer with your chronic pain, even though you continue to look for answers. You go to varying types of medical specialists. Varying types of tests are performed. Varying type of procedures are performed, and yet you continue to suffer with pain. If the system was so effective, the mere beginning of the process, when the pain was acute and the proper tissue identified and treated, would cause the pain to cease immediately, thereby ending chronic pain as you know it today. This must be perceived as a red flag. The overall system is failing, and it starts with the diagnostic test that's used to identify the initial cause of your symptoms. And when we say cause of our symptoms, we have to be looking at the premise of what tissue is eliciting the symptom. That's what's meant by cause. When we talk about cause, we have to be looking at the idea that pain is an indication of a tissue in distress, and that the purpose of the pain is to create conscious awareness of distress of a tissue. A tissue in our body is not functioning properly. The tissue wants the body and the brain to become aware of this so that an intervention could be created to resolve the distress of that tissue. Once the distress is resolved, there's no longer a need to create conscious awareness, and that's why pain stops, or whatever the symptom is that was trying to lead you towards understanding what tissue is in distress. So if we're looking at the primary purpose of diagnostics and the entranceway, the evaluation system, which really is trying to identify a tissue, the MRI and X-ray are completely invalid. You could find the structural variations that are identified: herniated disc, stenosis, arthritis, meniscal tears, spondylolisthesis, compression fractures, herniated disc, the bone-on-bone nonsense. It all can be found in as many people without pain as with pain. A simple study will show that of people over the age of 60, 90% of those who have no back pain have been found to have bulging or degenerative discs. 90% have no pain and yet have bulging or degenerative discs. How could you associate bulging or degenerative discs with pain? It's insanity. Conversely, of those people who had back pain, 85% could not have their pain associated to a structural variation like a herniated disc or stenosis. 85% of those having back pain, the medical establishment is acknowledging that 85% of those cases cannot be associated with a structural variation. Clearly, structural variations are independent to pain. Other tissues are eliciting the symptoms, and it's simply that the MRI is performed at the time that the person is experiencing the symptom that creates the false correlation that the structural variation that is found is causing the symptom. It is a complete fallacy. I always talk about the idea that if you had pain that started 2 weeks ago and you were told because the MRI found a herniated disc or pinched nerve or stenosis or any of those things during the time that you're having your pain, the association is with the structural variation creating the symptom. The implication is that if the pain started 2 weeks ago, then 2 weeks and 1 day ago, you should not have that structural variation. That in fact, if I were to have taken an MRI 2 weeks and 1 day prior, or 2 weeks and 2 weeks, or 2 weeks and a month, or 2 weeks and 6 months, that you would have the same structural variations, or that you wouldn't have the same structural variations found based on the theory that these are causing your pain. When in fact, you know, there's no question that these structural variations could not have started 2 weeks ago. They're slow and progressive in their nature. They take years to develop. Just from a lay person's perspective, you cannot believe that a herniated disc or stenosis or arthritis or a meniscal tear develops in 2 weeks. They're slow and progressive. They take years to develop. So the idea that you had this causing your pain that only began 2 weeks ago, and therefore the implication is 2 weeks and 1 day ago you didn't have these structural variations, it's another form of insanity. The other important thing to point out is that based on the Yas method, the theoretical basis for people having pain is that you're trying to perform functional activities. You don't have enough strength in all the appropriate muscles, so as a result, the muscle breaks down and elicits pain, or causes another muscle to break down and elicit pain, or causes misalignment of the joint surfaces of a joint that the muscle's attached to that have become weakened or imbalanced, and leads to pain at the joint. In these cases, the cause is muscular deficit. It relates to the idea that you're trying to create activities against gravity, which is a force. Therefore, forces from muscles must be created to work against the force of gravity to allow you to perform the activities without having symptoms. If you don't have enough strength in all the appropriate muscles or balance of all the appropriate muscles, there'll be a breakdown of the muscle. That's what's leading to your symptom. Well, if a muscle elicits pain, or a muscle refers symptoms, there's a false premise that only nerves can refer symptoms. That's a fallacy. Muscles can refer symptoms, such as a rotator cuff muscle in the shoulder referring symptoms down to the arm or the hand. Or a muscle can strain and impinge on a nerve. In fact, what in 99% of cases sciatica is. Sciatica is actually the piriformis muscle in the gluteal region impinging on the sciatic nerve. So in all of these cases, how many of these types of cases can show up on a diagnostic test like X-ray or MRI? The answer is zero. None of these. And if, in fact, I'm correct that these are the cause of pain in 95 to 98% of cases, then what we're looking at is more than 90% of you are being misdiagnosed by the mere use of diagnostic tests as your primary method. This is insanity. It's obvious. 30, 40 years of this, the failure rate for surgeries is in the 70 and 80 percentile. The medical establishment themselves were forced to create the term failed back surgery syndrome. The massive, unadulterated use of pain medication and pain management. The insane premise of now using radiofrequency ablation, which is cauterizing your nerves, or rhizotomy, severing your nerves, as a new mechanism to mask your symptom because pain medication can no longer be given, is insane. They're not even attempting to identify a cause and address a particular tissue. Once you enter a system where the final premise is that masking of symptom is the only thing that can be done, basically that's saying that system has been defeated. They no longer are willing to attempt to establish cause to determine what tissue is eliciting that symptom, and therefore they have no alternative but to try to mask your symptoms. That's what you see. It doesn't matter who the specialist is. It doesn't matter where you go. It doesn't matter where in the country you live. The reality is it's the same all over. It's widespread, and it is because it is intrinsic in the existing medical system. I give it a total F. You should give it a total F. If you're looking to move away from a system that is completely failing, you need to reach out and find the Yas method. The Yas method is completely different. The Yas method is based on a theoretical basis that pain is based on muscle and an inability to address dealing with the forces that are related to you performing your functional activities. It has a system of interpreting your symptoms. Diagnostic tests are meaningless. You don't even need to look at those. Your body is trying to provide the presentation of symptoms that allows you to determine which tissue it is, whether it's a bone, a muscle, or a nerve, which are the typical three tissues you could expect to be eliciting symptoms in the neck, the back, or the extremities. The Yas method looks at the symptoms, listens to what the patient has to say, and tries to understand based on what they have to say, what the symptom presentation is, and what some basic physical examination tests tell to identify exactly which tissue is creating the symptom. And if it happens to be muscle, which it is in 95 to 98% of the cases, which there is no specialist in the existing medical establishment designed to identify muscular causes, but the Yas method can. And if it is found to be muscle, then it allows you to create a targeted exercise program. And I am very specific in the premise that it's targeted, meaning that we're going to do the very specific exercises for the very specific muscles responsible for creating your symptoms and limiting you from performing your daily activities without dysfunction. If you want to get more information about how to get the Yas method, you simply have to go to my website, www.mitchellyas.com. That's mitchellyas.com. Or contact me directly at drmitchellyas.com. That's Dr. Mitch at mitchellyas.com. That's my email address. Contact me and let's discuss your issue. Maybe we can get you on the path through one of my books. Maybe we can get you on the path through a Skype evaluation. Maybe you need to come to my office in St. Augustine, Florida. Regardless of the way that you get the information, it is the only true path to resolving your pain. I give the medical establishment as a whole, cumulatively, a gigantic F. I believe you should too. And if you want to look to an alternative, a system that you can see that it has the capacity to achieve the goals you're looking for, and you would give it a wholeheartedly strong and powerful A, then find the Yas method. This is Dr. Mitchell Yas wishing you a pain-free, fully functional life. Bye-bye.